it's really important, I feel like, for my practitioners and providers to like have like a broad lens of all the things that kind of, you know, comprise who I am.
Immediately making the space feel welcoming, just in greetings, affirming that it is a safe space, and the welcoming that you're getting, checking in with you, how you're doing right away, what's going on. The level of empathy is really important. You can be told that there's support there, but if you don't feel it and know it and sense it and see it, it doesn't really make a difference, does it?
Being in active addiction has affected my experiences with the medical field, like hospitals such as like walk-in clinics, any of them. I've experienced discrimination, I've experienced, there's just this energy, like there was just this energy of like unwanted energy, like where I felt like I was unwanted. The tone of the voices that they used. I know that it's like a big epidemic here, so I could see it being very exhausting for other people to have to go through that experience of helping people that are in active addiction, but it definitely impacted me on in a way that I didn't trust the medical field, didn't feel like it was a place that I could go to.
It was actually the first time I went to the clinic I go to now, which I really like. And yeah, I was wearing a jacket that had a lot of pins on it. It had like a Black Lives Matter pin, it had like a trans flag pin, and I thought it was really cool that the doctor like commented on it and was like, oh, I see you're wearing that pin, I just wanted to check in to see if you needed like any specific like trans affirming care. And I remember like taking like a huge breath of relief, even though I didn't need any specific like gender affirming care at that point. It was just nice to know that that's an option, and that's something he's thinking about, and that's something he's been trained in.
I do expect a baseline knowledge, certainly within the healthcare profession, some level of awareness. Certainly, particularly if it's with my mental and emotional health, there has to be that, because I guess there's vulnerability in everything, whether it's your physical health, your mental, emotional well-being. Listening skills are really critical. There has to be a level of listening, right? That there's that understanding of, with First Nations people, of not interrupting when we're speaking. That's hugely important, so that we're able to properly express, and taking the time out to truly listen.
Starting with coming with like genuine openness, knowing that you're not going to know everything. When I'm working with my clients and they come in and they bring something and I realize I made assumptions about them, and now I got to put those down and come back to just being open, to starting with something as simple as asking someone what name they use, right? Not assuming because there's a form filled out, I may know what their name is, because perhaps that person is trying to access a medical service. They have one name on their ID and they think they have to put that name down. And actually, the name they use is different than that.
Another one of the like common questions, if it's not about my diet, it's always like, could you be pregnant? I'm like, no, there is really no way that I could be pregnant. And it's one of those questions that has like so many like loaded assumptions come with it. Accessing more like community-based healthcare and speaking with doctors who are more like queer and trans inclusive, like that question gets asked in like a very like gentle and like kind way, where they like double check, like, you know, is there any chance that you could be pregnant, or like you know, without making too many assumptions.
I had a lot of trepidation before Nika was born. The idea of midwives and working with them. So we chose pomegranate midwives in the neighborhood, which I didn't realize were lesbians and other queer folk that were working there. So I thought, oh, okay, that's cool. Let's I can do this. I can work with this and see how that feels for me. And it was a slow process. At first, I was really kind of cautious And I was like, okay. And we kept on going back for appointments, and it slowly slowly grew and grew and grew. But the level of care, and not just during the leading up to it, but at the house when Nika was being born, and afterwards, weeks following, when they came to the house and did the checkup and the followed up, I was so impressed and so pleased and felt so supported and safe and relieved, I think, as a father. Hugely relieved. I felt really affirmed that the trans queer stuff, it was all cool, and we just kind of moved through it and it was all good. And it really started Nika's life in a good way. There was so much room to bring that spirit into the world in a really affirming way, in a respectful way, truly respectful way.
Know that you cannot tell someone's health status by looking at them. The first thing is that like you don't know what their size is or what they look like or the shape of their body or anything like that. You don't know what their health is, so be open. And don't be surprised if maybe they're healthier than you think. And also just being open to like being wrong, apologizing if you make a mistake, goes a long way.
Certain things that someone has done to create safety for me, like on a physical, would be clear like eye contact with me, and they've discussed like really precisely and in detail like every step of the way what they're going to do, and also asking my comfort level and if I feel safe, if I feel okay. And as each step goes by, they say, okay, I'm going to do this. Is it okay?
For those of us accessing healthcare, a lot of us have been doing this our health is something that we've been attending to our whole lives. We might have information or about ourselves or know our bodies better than you might think. So allow us to like collaborate in the process and share what we know about ourselves. That might look like, hey, I don't know how much you know about X, Y, and Z, medical condition or health concern, would it be okay if I shared some of this info with you?
It's working on that relationship. And then once the relationship and that connection is made, then you've got trust. And then once you've got trust, you can really start your healing process.